Hello everyone. We are going to study effects of hypertension on our body organs. So what is hypertension? When sustained resting blood pressure of more than 140 by 90, it is considered as hypertension. There are various classifications for hypertension, like depending on severity, we have mild, moderate and severe hypertension. On etiological basis, we can classify primary hypertension and secondary hypertension. But for pathology purpose, we are going to study this classification in which hypertension is divided into benign and malignant hypertension. Benign hypertension is when blood pressure is more than 140 by 90 mmHg, but it is less than 200 by 100 mmHg. When systolic BP more than 200 and diastolic more than 140, it is considered as malignant hypertension. Benign hypertension, it progresses slowly, while malignant hypertension, in this BP rises rapidly. Benign hypertension causes less complications as compared to malignant hypertension, while in malignant hypertension, we see retinal changes. So as per our topic, pathological effect of hypertension, the different organs which are involved by hypertension are brain, which has risk of developing stroke, then heart, kidney, blood vessels and eye. Firstly, we will discuss about the arterial changes in hypertension. Hypertension affects the arteries. Morphological changes, they are independent of the etiology but vary depending on whether it is benign or malignant. So that's why we are discussing benign and malignant hypertension. So a little bit about the histology of vessels. This is lumen. It is lined by the endothelium. This is intima, which is comprised of low-cuboidal lining epithelium, endothelium and matrix, its connective tissue. Then media, comprising of smooth muscle cells, internal elastic lamina and external elastic lamina. Outer layer is adventitia. So firstly, what benign hypertension will cause in arteries? There is medial and intimal arterial hypertrophy of smooth muscle fibers. So smooth muscle fibers, they hypertrophied. The intimal muscle fibers hypertrophy into the longitudinally arranged bands to resist elongation of the artery, while the media circular muscle fibers, they hypertrophy to resist over distension due to increased pressure. So in this diagram, we will see medial smooth muscle hypertrophy that will lead to thickening of the blood vessel. Now second effect is elastosis. What is elastosis? There is an increased laying of elastic fibers close to the internal elastic lamina. It is elastosis. So elastic fibers, they are laid in the form either they completely duplicating the elastic layer or they will form multiple layers. Another effect is hyaline arteriosclerosis. So it is seen in elderly individuals due to aging. Why? The arteries are not capable of hypertrophy of smooth muscle or elastic tissue in elderly individuals. So the arteries, they will dilate, they show tortuosity and there is fibrous thickening of the vessel wall. The stress due to increased blood pressure in the vessel, it caused the endothelial injury that will result in leakage of plasma into the vessel wall and increased extracellular matrix production by the smooth muscle. This will lead to thickening of the artery. The wall of the artery is thickened. It becomes homogeneous, pink and glassy in color due to extracellular matrix productions. And the structural detail of the wall of the artery is lost. So as you can see in this picture, the homogeneous pink structureless appearance of the vessel or artery known as hyaline arteriosclerosis. In malignant hypertension, BP rises rapidly, so it does not allow much time for the adaptive changes which we have seen in benign hypertension. The damages are severe that will cause either necrotizing arteriolitis, that is fibrinoid necrosis, or hyperplastic arteriolitis or onion skin appearance due to smooth muscle cell proliferation in the concentric layer. So smooth muscles are arranged in concentric layer, giving the onion skin appearance. So this microscopic picture is showing necrotizing arteriolitis. The wall shows extensive pinkish colored necrosis, fibrinoid necrosis. It is necrotizing arteriolitis. And in this picture, you can see onion skin appearance. Smooth muscle cells are laid in onion skin appearance, leading to hyperplastic arteriolitis in kidney. So I think you must be confused between arteriosclerosis and atherosclerosis. Arteriosclerosis is a wider term which is thickening and hardening of the arteries. It is of three types: atherosclerosis, arteriosclerosis and monkey-bug sclerosis. In atherosclerosis, the thickening is due to deposition of fat, while in arteriosclerosis, the wall of artery becomes thick and it is hyalinized, and it is seen in hypertension. Monkey-bug medial sclerosis, in this calcific deposition in the wall of muscular artery is seen. Now coming to hypertensive heart diseases. So the hypertensive heart diseases, due to long-standing hypertension, there may occur left-sided hypertensive heart disease or right-sided hypertensive heart disease, also known as cor pulmonale. So the long-standing hypertension, it will increase the pressure within the heart. As an adaptive response to increased pressure and volume overload, the myocardium will undergo hypertrophy. So then the oxygen demand of myocardium increases. That will cause left ventricular compliance decrease, and there is decrease in cardiac output. If patient has additional coronary atherosclerosis, then ischemia will occur, that further leading to diffuse interstitial fibrosis in combination to myocytic atrophy and degeneration of myocardium fibers, increased distance of diffusion of oxygen and nutrients, further leading to cardiac failure. First, we'll discuss left-sided hypertensive heart diseases. In systemic hypertension, which will cause pressure overload on the left ventricle. Left ventricle will undergo compensatory hypertrophy. There is compensatory hypertrophy of left ventricular wall. But for how long it will compensate? Then ventricular wall thickening makes diastolic filling inadequate. At sudden point, there is diastolic filling inadequate, leading to cardiomegaly. The heart starts to enlarge and dilate. That will cause cardiomegaly. So hypertrophy of left ventricular wall will occur. The left ventricular wall thickness will be more than 2 cm. And there is cardiomegaly. Heart can weigh up to more than 500 grams. You can see the ventricular wall thickening. Here also the ventricular wall is thickened. Microscopic findings include enlargement of myocytes. The transverse diameter of the myocyte enlarges several times the normal. In late stages, myocytes arranged in disorganized manner and they vary in size. Myocytes, nucleus, they vary in size. Myocytes and their nucleus. There is loss of myofibrils, sharp angulation of myocytes. Random atrophy and death of the myocytes can be seen in addition to interstitial fibrosis. This is the microscopic finding of hypertrophy, cardiac hypertrophy. There is seen enlargement of the nuclei and they are of varying sizes, and disorganized myocardial fibers, disorganized arrangement of myocardial fibers, and muscle nuclei are enlarged and they are pleomorphic. Here also you can see disorganized myofibril, enlarged myofibrils with nuclei variation. Right-sided hypertensive heart disease or cor pulmonale. It is caused by pressure overload of right ventricle due to bronchiectasis, pneumoconiosis, COPD, emphysema or primary pulmonary hypertension. In this you can see right ventricular wall thickening or hypertrophy more than 1 centimeter and there is dilatation of the right ventricle. So cor pulmonale is diseases of lung causing pulmonary hypertension that further leading to changes in the heart, often associated with heart failure. There are two types of cor pulmonale: acute cor pulmonale due to massive pulmonary embolism and chronic cor pulmonale due to pulmonary hypertension or any other cause of lung disease. Next we'll discuss changes in kidney. Benign hypertension will cause benign nephrosclerosis. The gross appearance of kidney is granular contracted kidney. Microscopically, kidney will show hyaline arteriosclerosis, tubular atrophy, interstitial fibrosis, glomerulosclerosis, and periglomerular fibrosis. Malignant nephrosclerosis is seen in malignant hypertension, and grossly the kidney will show flea-beaten appearance, flea-beaten kidney, multiple red colored dots. Microscopic appearance, there is seen necrotizing arteriolitis and onion skin appearance of the arterioles, or hyperplastic arteriolitis. Now changes in brain. So due to hypertension, we can see hypertensive encephalopathy. That includes cerebral edema, petechial hemorrhages in the brain, fibrinoid necrosis of arterioles, and fibrinoid exudate around the damaged vessels. Subcortical leukoencephalopathy can be seen. That will lead to diffuse loss of axons, diffuse demyelination, and gliosis. There are seen small necrotic foci containing pigmented macrophages known as lacunae. Now last we will discuss changes in the eye, retinal changes known as hypertensive retinopathy. So there is a narrowing of the arterioles, flame-shaped hemorrhage, waxy exudates can be seen, microinfarction of nerve fibers, that is cotton wool spot, and axons are swollen and they resemble shape of cells known as cytoid body. So cytoid body can be seen in addition to papillary edema. That's all in the hypertension. So you must prevent hypertension by eating healthy fruits and vegetables, doing yoga and exercise regularly, avoid tobacco and alcohol consumptions, and last but not the least, reduced salt intake. Thank you very much.